the public health department started monitoring the situation as soon as we learned about the first case abroad. So that was December of 2019. And so our initial response group, the public health department response group, came together in January. And that group included the health officer, it included epidemiology, emergency management services, and preparedness staff, as well as other key management staff, because we needed to monitor. We needed to monitor the situation. And so as the situation evolved, we got together small teams. We formed small teams to deliver the needed interventions. And we learned early on that although we had small teams working on the response, it would not be enough to deal with what was ahead of us. And that was our first very large surge. So because of that, we tapped into state and federal resources. And we received quite a bit of assistance, not only with supplies and equipment, we actually received help from personnel to take over or help with some of these tasks, such as work within epidemiology or other areas. And so, well, since then, we've changed quite a few of our processes, internal processes. We've enhanced some of our systems, and we've definitely increased our workforce to better respond to the needs of our community.
And by the workforce, you mean nurses and contact tracers, all that of the above?
Yes, different types of public health personnel to support the work that we're doing at the public health department.
And what advancements have you noticed now?
What advancements have we noticed? Well, I'll just talk in general terms. We definitely know a lot more about the virus. We've seen great advances in epidemiology, clinical care, prevention, treatment, vaccine development, and well, as you know, all of that is tied to public health.
Yes, of course. And are we on the right track to getting everyone vaccinated?
Of course we are. Vaccine supply to come into Imperial County, that it's been limited. It's been a little slower, but we are doing what we can with what we have. And so it's not only the public health department that is vaccinating. There are quite a few enrolled vaccine providers in our community that are helping with this great effort to vaccinate our community.
How many people in the county have been vaccinated so far?
So I'll tell you how many doses have been administered to county residents, and that's close to 32,000. And fully vaccinated, we have about 8,500 individuals.
Wow. And do you believe the county would be prepared if there were to be another surge?
Yes. Public health. Let's talk about public
health.
Yeah. Well, I can tell you we're definitely better prepared than we were a year ago. We're definitely prepared, from the other pandemic that we had. So there's a lot of lessons learned from prior years. We had the H1N1 pandemic. We learned a lot. Of course, COVID-19 is totally different. We also have an emergency preparedness program. We have the epidemiology program and their surveillance activities. And so a lot of that has been there, and we've been, preparing for these types of situations. But are we better prepared than a year ago? Most definitely.
Wow. And overall, with the public health department, what have you all learned during this pandemic?
What have we learned?
Sure,
a lot of lessons learned, that is for sure. When we have a pandemic, we've learned that there needs to be a science and public health based response that needs to be communicated very clearly. And that's at all levels, because if not, then it'll create a lot of confusion in our community. And that's the last thing we want to have when we have a pandemic. Leadership and partnerships are really important, in particular during very stressful and uncertain times. And this is not really a lesson learned. I think we've known this, but Imperial County is very, very resilient, and we know how to adapt to the situation. So,
should the county still take precautions even though there are vaccines?
yes, that's another yes, of course. Yes, even when there's vaccines already here, and vaccines are an effective tool to help us get out of this pandemic, there are still things being learned about the vaccines. And for example, scientists are still learning how well vaccines prevent you from spreading the virus that causes COVID-19 to others. And they're also learning, how long COVID-19 vaccines protect people. So for those reasons, people who have been fully vaccinated against COVID-19, they should still keep, taking all those precautions in public places, wear a mask, stay 6 feet apart from others, avoiding large crowds, washing the hands often with soap and water, and all of those prevention measures that we've been talking about, they're still really important.